Right. So as the Tories continue their flat refusal to engage with pretty much anybody right now, taking strike action over unsafe service pay and conditions, the health sector is looking at taking things up a notch with their biggest day of action to date coming next month. February 6th, mark the calendar, because that's when we're going to see some coinciding strike action appear between unions and between different healthcare workers, as ambulance workers and nurses from Unite, from the GMB and from the Royal College of Nursing all walk out on the same day in what is being called the biggest day of industrial action within our NHS since the NHS was formed in 1948. We shouldn't be too surprised things have escalated to the point they have, with ambulance queues forming, unable to offload patients for treatment. They end up being treated in the ambulances instead. They are stuck there for so long that ambulance workers are changing shifts just to end up taking over the queuing of the patient the previous shift were caring for. Holding up ambulances means they don't come as quickly, if at all, to others. So people are dying needlessly without help ever arriving. Some 500 people a week. Nurses are overworked, which is itself unsafe. The more investment in training, the investment in training in more nurses still isn't being taken seriously enough. The support packages that were in place having been removed. The mess the NHS is in is one entirely of the Tories' own making. There have been numerous reforms, of course, a word that is supposed to imply improvement, is it not? But has only ever worsened the service. In fact, many commentators will point to the start of the rot under the Tories as being the very first reforms, the one Andrew Lansley brought in 2012, which rapidly increased privatisation in the health service. But actually, it had been softened up by them from the get-go. By 2011, just a year into the coalition regime, elective surgery waiting lists like cataracts, hip replacements, that kind of thing, were actually coming down. But nothing else was. Cancer waiting lists, for example, rose from 2011 and had increased by 30% by 2013. People waiting more than 4 hours in A&E had increased by 50% by 2013. And those waiting to be moved from a trolley to a hospital bed rose by 200% over that first 3 years of Tory rule. By 2016, another 3 years down the line, the trolley to hospital bed waiting times have more than doubled again. A&E waiting times of more than 4 hours had more than doubled. Cancer waiting times were still rising, and the elective surgery lists that had dropped before were now above their 2011 rate too. Why had everything risen so hard and so fast under the Tories? Well, of course, they'll find every excuse under the sun for it, won't they? They will blame NHS crises every winter, but real terms funding was no longer going into the actual service. Training was hit when we weren't training enough health workers to begin with. Units were being closed and beds were being scrapped. Those Tory reforms more interested in outpatient treatment where possible and less on more expensive hospital stays. It's all austerity to blame. The thing is, if you need to be admitted for what is wrong with you, then you need to be admitted. The Tories measured all of this in cash, and now we're paying for it all in lives. Each and every year, these waiting lists worsened. The pandemic didn't strike until 2019, of course, where we then saw a dip as people stayed away from hospital. But by then, those trolley to bed waits were up over 800% compared to 2011. The A&E wait times up by 600%. Cancer waits up 500%, and elective surgery waits up some 250%. And as much as the Tories blame COVID for everything, and they're blaming strep A and flu and things like that now, it actually gave them cover because the service was already in a catastrophic state by then. By 2016, strike action was already taking place. The young doctor strikes, you might recall, but now following COVID, where are the waiting lists up to 2022? Compared to 2011, 11 years earlier, trolley to bed waits are now up over 1,600%. 16 times they've gone up. Cancer treatment waits up over 1,400%, 14 times bigger. Elective surgery and A&E wait times of more than 4 hours are all up over 1,000%. 10 times bigger than they were in 2011. And remember, they dipped during the pandemic, making these latest rises all the worse. Stats like that prove just how unsafe the service has become, that to all intents and purposes, for some patients, it may as well have already failed for all the help they're getting in the time that they need it. This is far and away the core reason, the biggest reason for these strikes. Pay, although part of it, is not the main driver. It's people who entered a caring profession being unable to offer the care they want to because of the destruction 13 years of the Tories has wrought. And with Labour refusing to even stand with a placard with them, the unions, the workers themselves, are having to do it all for themselves. There has never been a crisis like this in the NHS before, and it is entirely Tory-made. They've failed to recruit adequately. They've driven people away from the service. They've reduced capacity. The pandemic ultimately saw hospital waiting lists fall, not rise, as we stayed away. If any Tory mentions that, they need rinsing for it. Any Tory claiming it's all okay are lying, because it's going to fail if we don't see the government shift towards proper funding in the actual NHS and not the outsourced bits of it that pretend they're NHS. But their answer right now is to clamp down on the right to strike instead. They're putting authoritarianism and control freakery ahead of delivering for us a functional health service. The Tories are a danger to each and every one of us now. So support the nurses, support the doctors, support the paramedics and everyone else taking strike action wherever they're taking it right now. Because if they lose, we all do.